then our OMM Club model, with its relatively low cost, can move the needle in the youth mental health crisis and truly save lives. So while Josh would not have joined the OMM Club, maybe if there would have been an OMM Club at his school, if he had heard more messages from his peers saying it was okay to not be okay, and it was okay to seek and to get help, maybe my family's story would be different. That's why I'm so excited about the research you are going to hear about in just a minute. This is our first ever empirical evidence suggesting that our model creates measurable impact far beyond the teens directly participating in clubs. And it confirms what we hear all the time from teens in the program, who tell us about the positive impacts their clubs have across their school. I don't want to overstate these findings, and there is still so much learning to do. But this is quantitative evidence that demonstrates our model creates impact far beyond the teens directly participating in our clubs, essentially proving our theory. This is a powerful lever for change that positions us to impact hundreds of thousands, even millions more teens. When I first came to this work, I knew it was important to be rigorous about measurement. And then those close to me and the organization continued to push this concept, including Aras, who you will meet soon, and other board members, Laura Beth, our Chief Program Officer, and Dr. Wei, our Director of Impact, and many others actually here in this space. What I firmly believe now is if we don't understand the impact we are having, we can't confidently expend resources to their highest value toward our mission, and ultimately our vision of the day when no teen dies by suicide. We have infused this value throughout our organization, and we invest a lot of staff time and resources into making sure our work is grounded in evidence, both in the established body of research as well as direct studies of our own work. I am just so proud to see these investments bearing fruit. And the timing is ripe, as we are embarking on a new journey over the next 5 years, bringing our work to scale. We've grown rapidly in recent years. We reached about 90,000 teens last school year, a 35% growth from the year before. Our footprint has grown too, and we are now working in close partnership with 4 public school districts in the Washington, D.C. area, and continuing to further saturate this region. The evidence you will hear today is a key validation of the mechanism behind our strategy to scale our impact. The youth mental health crisis is enormous, as everyone here knows all too well. At this scope, we need new solutions to reach farther and faster. Teen-led models are an important part of that story, and this finding is an important validation that our model is not only cost-effective, but impactful. To talk through this impact, I'm so deeply grateful that we have Aras Jizan to moderate this panel. Aras is a senior program officer at the Gates Foundation, where he leads efforts around research and innovation to improve economic outcomes for low-income Americans. Prior to joining the foundation, Aras spent over a decade developing data and technology solutions that empower people to navigate towards greater opportunity through work at the Agency Fund, Community Solutions, and Chemonics. He's also a longtime OMM board member, the first person to ever walk me through a logic model so many years ago, and someone I'm honored to call a good friend. You all are in such good hands, and I'm very pleased to turn you over to him now.
Thanks, Lauren. Thanks for the kind introduction and the chance to be part of this conversation. I'm really excited to be moderating this panel. So I'll start with a quick round of introductions, and then we're going to dive into a discussion in a few parts. I encourage everybody to participate in the chat, and we'll be moderating a Q&A at the end of the panel. Okay, so I'm so excited to introduce our panelists. First up is Dr. Wei Ng, who's the Director of Impact at Our Minds Matter. Trained as a counseling psychologist, she's passionate about decolonizing mental health and advancing equity. Transitioning from direct clinical services to prevention work, She applies an intersectional lens to research and storytelling to elevate marginalized voices. Next, we've got Dr. Jordan A. Booker, who's an associate professor of the Department of Psychological Sciences at the University of Missouri. Dr. Booker received his PhD in developmental psychology at Virginia Tech and completed postdoctoral training at Emory. His research spans topics of emotion, personality, and identity development across adolescence and into early adulthood. Next, we've got Douglas Goettel, who's the director of school mental health at DC Public Schools and founder of Goettel and Thrive. He brings 17 plus years in school and community mental health to this work. And he specializes in trauma responsive systems, play therapy, sand tray therapy, and EMDR, and trains nationally on sand tray interventions. And lastly, we have Chase Pantesi, a junior at Tufts University studying clinical psychology and child development. He researches adolescent recovery outcomes and works with children experiencing acute mental health crises. He's been a passionate leader in mental health advocacy spaces since 2019 in an OMM club and with Active Minds at Tufts. So across the panel, we've got a bunch of different views and backgrounds and expertise represented, which I feel so excited about. And so we'll dive into the discussion, and just so folks have a sense of where we're headed, we're going to start with a bit of background about why research matters and how this research study fits into a broader tapestry. And then we'll move to talk about the actual research. What did we learn? What are some open questions? Where are things headed next? And then we'll move into Q&A. So just a sense of the flow. But Dr. Booker, I'm going to kick it off with you. You're an accomplished specialist in adolescent development. Could you talk a little bit about what excites you about this research with OMM? What felt important about these questions and in the context of the field? And maybe one thing I'll say is, a lot of us on the line, we only understand one or two pieces of the broader puzzle, so to speak, in terms of the research landscape for youth mental health. I feel like you have a good sense of the broader puzzle, and so maybe help orient us to how this piece fits into the broader puzzle.
Absolutely. Well, good afternoon, everyone. Great seeing you and being with you all today. So just there are a ton of different elements, a ton of different pieces about the spirit of this work and the efforts coming together to really meaningfully and systematically study kind of what is going on for young people, what is some of the potential and promise of Our Minds Matter for young people that really, when colleagues were first reaching out and starting some of these conversations, just felt like an incredibly exciting opportunity. It's really proven to be an incredibly fruitful and exciting set of insights that keep emerging from this work. I'm going to just step back a little bit. I'm going to try to be good about time, not lecture here, but just appreciating kind of this landscape of where high school age folks, where middle school age folks into high school are really coming from with some of their big shifts, some of their big changes. And, the normative but challenging sorts of ongoing experiences that are prevalent across these years when it comes to things like handling emotions, handling different relationships, sort of figuring out next steps. There are so many big, important improvements in how young people are managing their different emotional experiences, how they're using those in the service of big school tasks, big recreation tasks, figuring out next steps after high school, a whole bunch of important things. A lot of ways that young people are developing skills that help them manage that, but also ways that they continue to benefit from the feedback and guidance they get from parents, other teachers and community adults, and from their friends. And that last piece of kind of what friends bring to the table, we've known for a long time is really important. We haven't always done as much as we could to try to study that meaningfully. But those kinds of gaps really fit alongside, they dovetail with a broader, and this was mentioned already, a broader historical set of challenges for emotional functioning, for mental health for young people. We know, partly because puberty is just a whole big thing and a whole lot of changes all very quickly. It's hard for everybody, but there are also all these other big changing expectations and demands on time and energy and effort and skill that young people are sort of navigating and figuring out. A lot of that just comes together in ways that are really intimidating, really daunting, and feel very hard to look past and look beyond for a lot of people in very reasonable ways at times. So that sort of broader landscape, that shift has gotten even more severe for a lot of young folks since major impacts of the COVID-19 pandemic. We're still seeing things percolate from the major impacts of shutdowns into figuring out a new normal, figuring out what's next for folks. Those different challenges, alongside the typical sort of developmental things going on for folks, it sets up a very important, very timely, very meaningful space to better understand what is going on for folks so we can better meet their needs and see them succeed and see them thrive. In a lot of different ways, we could go about trying to do that better. Programs and initiatives like Our Minds Matter that are very intentional about thinking of peer influence, peer leadership, are fairly rare still in the grand landscape. There are a few folks talking about this in some disparate spaces, but no one I know of who's doing this kind of work in this kind of way at this scope, in the way that Our Minds Matter has been doing for multiple years. So this was a big area of just excitement, and great fit for a set of needs that really felt important to try to contribute in the ways I could, and has just time and again proven to give some really cool, really compelling, really exciting, really me motivating, but I think for a lot of other colleagues as well, really inspiring insights on kind of, okay, we can take some time, we can figure out some work that's going to be really accessible, really exciting and engaging for young folks, and hopefully have some nice benefits and impacts for them, and for their other friends who are in different spaces on schools. Again, some of those ideas of changing broader customs, broader norms across an entire school community, kind of changing the narrative a little bit on what's safe to talk about, what's appropriate to talk about when it comes to mental health. That is such a huge set of impacts, and a huge need nationally, that this has been a really exciting set of efforts here.
Thank you for that context. And I'm always really interested to know, for outside partners, what brings you to this type of research partnership, because you have so many different options available to you, so many different things you could be working on. So the fact that you chose to work on this, now I think we all understand a little bit more about that. Douglas, I'm going to come to you next. You're a champion for comprehensive mental health approaches in your role in the DC Public School District. How does peer-to-peer programming like OMM fit in with your theory of change? I mean, you're in a similar position to Dr. Booker. You have a lot of different competing priorities or places where your time and attention is getting pulled. How does this research help you in your work, or give us a little bit of a flavor of how this fits into the broader constellation of things that you have to pay attention to and prioritize in your role?
Yeah, so I'm really happy, that this study has come out. Things that I am seeing anecdotally in my visits to the OMM clubs, and seeing the impact of the work, and really having evidence to support the effectiveness of the reach of these clubs in terms of destigmatizing mental health, and being okay talking to the social worker or psychologist at the school. What we do know that anecdotally and backed by research, that how leveraging the social networks of adolescents to support those messages of help seeking and being connectors to school staff, who can help, is an effective tool for suicide prevention. And the peer-led model, that is the hallmark club model of Our Minds Matter, it does play a very significant role in our school district's multi-pronged effort to prevent suicide through professional learning for our non-clinical staff, for our educators and our school-based staff, crisis response training for our clinicians who are on the school's budgets, and use of our online presence through our website as an educational tool for our parents and caregivers to recognize the warning signs and what the resources are in our schools and in the community. So it fits perfectly into the gap that we were looking to fill, and that was elevating student voice and having student voice at the table as it relates to the mental health services that are afforded in our schools. One of the things, the problems that we were trying to solve was this idea that a lot of our students in high schools and middle schools have this idea that um, you have to have a serious, quote unquote, serious problem or have a disability, have an IEP or 504 plan to see the therapist at the school, the social worker. And that's just not true. And that's a myth that we have been trying to debunk. And the only way, the best way to do that is having our young people be at the table, our young people having their voices amplified to say, no, this is something, any problem is not too small that you can talk to someone about. And here are the folks in the building that you can talk to, and it's okay. And a number of our students who are in the clubs are connectors to the clinicians that are in the building. So it's a perfect alignment.
Well, I feel like that's a perfect tee up, Douglas, because we have one such connector and former connector in the high school context on with us in Chase. And so maybe I'll come to you next and ask, thinking back to when you were leading an OMM club a few years ago at your high school, what were you hoping your club would create across your school? Can you tell us a bit about whether there was a particular moment where you felt like your club had created meaningful changes in the school context? How did you sort of understand that and think about measuring it, which is a tough thing, I think, to do when you're inside the school context itself?
Yeah, well, thanks so much for having me. I think when I became like a member of my OMM club and then I was invited to be a leader, I was hoping our club would create a safe space for like these really important stigma breaking conversations. And at least, well, for all of us, it was a time like in society where we were facing a lot of challenges, like right before or right at the beginning of COVID, but also like Dr. Booker mentioned, it's a difficult developmental transition in high school. And so it's really important. I thought it was really important looking back on it to have these conversations because we needed a place to be like authentic and vulnerable in those stigma breaking conversations. And I feel like in that creating that meaningful change, um I can say it was like super clear at the beginning that we were making meaningful change because being a mental health advocate it's not an easy job, and there are very real challenges that come with mental health and talking about it. But I think every time we had a vulnerable conversation in our club meetings, um it really brought me and my other club members hope to like such a difficult time. Um, and looking back, I'm realizing that everyone who was in that conversation was one of those like change makers, and that every change like in the broader like in my high school just started with like a small group and then it would reach that broader community, and that yeah, it makes me really happy to look back on that. And I felt like just in terms of looking at our success and relating it to the like data from OMM, I think there were ways that we defined success that were more concrete. Like in OMM events, we talked about, like the number of Instagram followers we had, or how many members attended our club meetings, or how many school-wide campaigns we held, and things like that. But the real success to me was coming out of a club meeting and thinking, someone talked about this mental health challenge that they faced or their perspective on this mental health issue that I didn't know about, and that we can always learn more as leaders. And so, like, the feeling of those special conversations were really important.
I love that. And I think what that brings up for me, Chase, is there are multiple types of evidence and multiple metrics that we care about. And I know Lauren alluded to this, and Dr. Jiwei can talk more about it, but OMM tracks a lot of different things, including, I think, talking to student leaders like yourself about what's happening at the club level on the ground. So maybe, Dr. Jiwei, I'll come to you next. Can you help orient us around the broad set of research, evidence, data that Our Minds Matter looks at, and then help us understand why this research felt necessary or complementary. And maybe that connects a little bit with a bigger picture question, which is, how do you guys think about the why behind a peer-led approach? And then what research did you already have about that pointed you in the direction of a peer-led model? And then where did you guys see gaps in the literature and your own understanding of what works in terms of peer-led models in schools and that sort of teed up this research project?
Yeah, thank you, Aras, and such an honor to be here with all of you today. But there are many parts to this question, so I'm going to try my best to break it down into different sections. I will start with the who. Why peer-led? Why not adult-led? And what's the research saying that back this model up? I'll start with that first. So I think a couple of you mentioned about COVID era and, with that national recognitions of the youth mental health crisis in recent years, it's no secret that we do see more resources pouring into mental health programming at school level, which is a good thing. But what's missing though is the voices of young people themselves. And this is not to say that programs don't work, they do, but we also know that developmentally teens experience the world differently and peers play an important part in their lives. And I think Dr. Buka just spoke about that earlier. So therefore, we oftentimes see that teens are often the first and sometimes the last line of defense because they often turn to each other first before they would go to the adults. And recognizing this, we leverage the power of peer influence, creating spaces where teens can build strong relationships, develop coping skills, and support friends who are also struggling. I was just at the Mental Health America conference last week, and one thing that I heard consistently from our youth speakers was, nothing for us without us. And for this generation, those words aren't just a slogan, they are a call to action. Now, onto the how and the what, meaning how do we approach this work? And what changes are we hoping to make? To answer these questions, I think we need to go back in time for a little bit. When OMM began in 2012, it was focused on one-off assemblies and wellness weeks like Stress Less, Laugh More. And while these initiatives were impactful, we heard from teens consistently that they needed something that's more consistent and sustainable to make mental health a real priority in their schools. And listening closely to their feedback, we consulted with subject matter experts and key players in the field at the time and drew from the JET Foundation's comprehensive approach to suicide prevention. Let me figure out the share screening thing because there's a chart that I would like to share. Give me one moment. Okay. Interesting, it says. Okay, can you all see? Give me a thumbs up or something because I can't see.
Still loading. Here we go. We got it.
You got it? Okay, awesome. So this is the JET Foundation's comprehensive approach to suicide prevention that I just mentioned about. And this is an evidence-based framework. And we drew from this framework to design our flagship school-based peer-led club model. And as you can see, there are many components to this comprehensive approach. And while crisis management and access to mental health care are all critical parts of this whole picture, no one organization can do it all. And so for us, we decided to focus on the upstream, That is, building protective factors so that more teens can gain support and resources before mental health struggles reach a crisis. And our curriculums are designed to center on 4 core protective factors that we derive from this model, which are self-care and healthy habits, social connectedness, pro-social skills, and help seeking. We also know that to truly support teens, we have to meet them where they are. And that, let me just stop sharing so that I can see y'all. I prefer that. Okay, where was that? So, okay, we were talking about we have to meet teens where they are, and that is in school, right? Because teens go to school. And for many young people, especially those who are marginalized or underserved, from the data and from research, we know that school is often the only place that they can access mental health support. Recognizing this, OMM brings programming directly into these spaces, helping teens build supported peer networks that not only strengthen their well-being, but also ease the strain on already overburdened school systems. And I can go on and on about the literature, but for the sake of time, I would just say that our model is aligned with the positive youth development principles. And research shows, and our data also confirms, that when youth are involved and engaged as equal partners, we see greater impacts. And public health evidence also show that peer-to-peer interventions can be effective in behavioral change. We see that oftentimes in the substance abuse prevention literature, in bullying prevention literature, and what we're trying to replicate here through our own research, and also to fill the gaps in the youth mental health and teen suicide prevention field is, making sure that this peer approach is also working for our concerns here. And the last part of your questions, I believe there's questions around challenges in conducting this kind of research in school setting. Yeah, I would say getting the approval from school districts and recruitment of schools who are willing to participate are the main challenges. But we are very fortunate to have strong district partners like Douglas here who believe in our work and are a strong champion and advocate for us. So thank you, Douglas. We wouldn't be here without you. But I have to say that process does take time and persistence. It took us 2 years to gather the sample size we need, including getting 2 schools to agree to serve as a control group, and that is the hardest part. We do offer incentives to schools as a token of appreciation for their time and support. And we're talking about like bringing snacks to the staff, nothing too, too fancy, but, just some snacks. We also share aggregate level school only data with them, just so that they can, use the findings to inform their own school programming and policies and resource sharing and stuff like that. But yeah, bottom line, it really does take persistence and strong connections. But I feel like, all of those efforts and time put in do pay off, especially with the findings that we are sharing today. So we're excited that we're here today.
Fantastic. I feel like this is such a strong overview that is helping me feel more confident in my understanding of how to interpret some of the findings. So without further ado, maybe we'll dig in there. And I think there are 2 big themes that y'all observed in the research that we want to talk about today. So maybe I'll start with the first one, which is help-seeking behavior increased across the student body. And maybe I'll come right back to you, Dr. Jiwei, to give us a little bit of a flavor of this before jumping to Douglas and hearing more about the school perspective. So coming to you next, Douglas. But Dr. Jiwei, one of the big findings in the research, I think, is that teens at schools with OMM clubs are more comfortable talking to a counselor. And this aligns, I think, exactly with something that we heard about earlier, which is, I think, a big thing that all of us know anecdotally is that often people view these school supports as not for me, right? Oh, I think I'm not in a crisis, or maybe I'm nervous about the potential stigma. There are all kinds of reasons why young people, why all of us, frankly, might have some friction or resistance associated with help seeking, or it feels hard. So maybe how should we understand what you guys saw in the research about the impact of an OMM club, and what are the implications of this finding for Our Minds Matter and for other organizations?
Great, thank you. And again, I'm gonna share a chart to help our audience better understand what we're talking about here. So you can see the chart here that shows where students in OMM clubs fall in terms of their comfort level in seeking help from school counselors, followed by students at schools with OMM clubs, but they are not part of the OMM clubs themselves, as compared to students at schools without OMM clubs. So Laura mentioned earlier that this is our first time to be able to compare teens participating in OMM clubs with their peers at the same school, and also at schools without a club, and that's a big thing. But what we found was striking. Even students who weren't active club members, but were in schools with an active OMM club, reported feeling more comfortable seeking support from school counselors than students at schools without any OMM presence. And this findings really points to a powerful ripple effect, where simply being in an environment shaped by OMM's culture, messaging via school-wide campaigns that oftentimes host, and peer influences can benefit the wider student body. When we visited the control schools, those schools without OMM clubs, there's something that we noticed, right? Those schools had similar student demographics. We're intentional about that in our study design. We chose schools that have comparable student demographics. And those schools also had their own mental health initiatives in place. And even with all these factors at play, we still saw a clear pattern. That is, students in OMM schools, even those not actively in a club, felt more comfortable seeking help. And being able to capture evidence that OMM's positive influence on help seeking reaches beyond just club members, despite these other supportive programs, may be our biggest finding just yet. As for implications, for organizations working to improve youth mental health, this finding shines a hopeful light on the power of team-led approach. It reminds us that young people are not just participants in change, they are the change, and they are capable. And when we equip them with the right tools, trust them with autonomy, and also surround them with caring and supportive adults, they can transform their schools in ways that ripple far beyond any program's boundaries. And think of OMM as a spark, right? It starts small, a few students guided by a supportive adult, they gather to form a club, then they host meetings, they organize campaigns, and they model talking openly about mental health. And over time, that sparks grow. The culture shifts, seeking help becomes a little less scary, a little more normal. And even students who never attend a club meeting begin to feel that shift. And we have seen this ripple effect firsthand. Student leaders tell stories of being approached by peers they barely knew, connected through a mutual friend who trusted them to help. Club sponsors, who typically are school mental health professionals, are also recognized as the safe adults in the building, the ones students know they can turn to when things feel heavy. And this moment, small but profound, show us what's possible when we believe in young people's power to lead. And that is the heart of OMM's impact, in my opinion. A growing network of hope, compassion, and courage, led by teens who are proving day by day that change begins with them.
I love that. And this is a really powerful chart, and I think we have some questions in the chat that we'll get to in just a few minutes about some of the methodology, and I'm excited to nerd out with the panel. But before we do that, Douglas, I want to come to you. Something that Dr. Jiwei just said really, I think, resonated, and I wondered your perspective on it, which is, schools have a lot of constraints, right? And school administrators like yourself have a lot of constraints that you're facing in terms of budget and staffing. And so something that Dr. Jiwei said was that students are not just help seekers, they can also be sort of champions for improving the help seeking of their peers or a delivery mechanism for support in schools. I was curious to hear your perspective on that. Given the limited capacity of school mental health professionals, how can programs like Our Minds Matter complement, not replace, but complement professional support?
Yeah, at our school district here at DC Public Schools, we do have um, a workforce of 240 social workers who are on the school budgets, which is not, which is very different than many school districts. We're very fortunate to be in a school in a city that really values school-based mental health, and that shows in the budgeting in our city. So I have our city leaders to thank for that. But even with that, resources are strained, and uh, where our minds matter fits into this tapestry of supports, as we tend to as I refer to the many supports that are afforded to students, is that the club meetings, and many of the ones that I have visited, are therapy adjacent, in a way, because, and Chase referred to it as having vulnerable conversations, um, and a lot of the campaigns are also focused on wellness, and certainly on help seeking. So there is space in those meetings for uh, the club members to share about what's going on with them, that also often is precipitated by those opening connections, uh, and students who are in the clubs. We call them youth mental health ambassadors in DC public schools. They share a lot of themselves in that circle time. But what I appreciate about the model, and I believe it's this way at other school systems, is uh, for our adult leaders, we work hard to recruit two adult leaders per club, or adult sponsors, and one of those club sponsors is a mental health clinician, and so when things get heavy, and where there may need to be clinical support, we do have at least one clinician who is sort of supporting the group, that can be there if things require that perspective and skill set, uh, if students disclose, and there is a need to really hold space for those types of disclosures.
It's great to hear. And I really appreciate how you sort of teed up this sense of the tapestry and how different actors within schools are working in concert. I know there's a second theme we want to touch on, and I want to do that quickly. And then I see lots of great questions in the chat that are digging into the methodology, and so we'll go there in just a second. But I think the second theme really builds on the first one, which is that OMM teens reported greater mental well-being, and this was connected to academic motivation, kindness, and life satisfaction. So here we're broadening the aperture. So we're not just looking at mental wellness or mental health outcomes, but we're thinking about like more holistic, I'll say like student well-being. And so Dr. Booker, maybe you can hum us a few bars about this research. How did you guys measure or sort of understand the relationship between OMM clubs and these broader set of indicators? And what does that suggest about how mental well-being can support other outcomes?
Yeah, great questions, and some great questions emerging in the chat as well that we're excited to come back to a little bit later. For our approach here, we were trying to balance basically getting a good sort of battery of items covering a number of different sort of constructs, ideas, ways of appreciating as holistically as reasonably possible different areas of adjustment and functioning in young people's lives, while also trying to be mindful of time and mindful that they've got a whole lot of other stuff they need to get done over the day, and we're trying not to disrupt classes. So we asked and we pulled from some different existing measures, typically proven, data-driven, data-based measures out there on some of the biggest ideas about areas of functioning and healthy development for young people. So things like psychological well-being, things like feeling well connected to other people, one of the biggest human motivations out there, biggest drives that you can imagine. Things like having more motivation for work, things like some stressors or pressures young people might feel, confidence in driving meaningful and positive social change, so on and so forth. We pulled from a number of long used, widely used measures in that regard. We sometimes trimmed some of those scales just to not be quite as time intensive. But we were really excited about a set of different measurements that would let us appreciate different areas of possible functioning for folks. When it came to thinking about sort of involvement and exposure to Our Minds Matter, we had a few different items we used as well. The starting point was just whether students were currently involved in Our Minds Matter programs and or whether they were at a school that had an active club. So part of that was just wrapped into which schools we're sampling from. We had some of that information. We can make some of those determinations, but we asked students outright, were they currently club members? Were they leaders in clubs? How many different Our Minds Matter clubs had they participated in, or meetings had they participated in up to that point in the year? We had been intentional for this most recent year in recruiting students in the spring semester, close to about February, March or so, because we wanted some time where students could have had some time with their clubs. We were aiming for one snapshot. We'll come back to the limitations on one snapshot later, but thinking of if we've only got one really good time to pull folks in, being mindful of some of the just logistical challenges, one makes the most sense. You want to avoid your big exams, you want to avoid spring break, but you also want students to have had some time to be settled into different school activities, into kind of how things are going over the course of that academic year. We also asked students about how well supported they felt they were from other other club members. This was really a specific measure we honed in on among Our Minds Matter students. So we had some other reports of how well connected, sense of belonging students had broadly across school, but also within the club. So another way of appreciating how club involvement, how club exposure might be operating differently for folks. We looked at how these different items were related to each other. So across all of our students, we could appreciate how things like feeling like you've got greater well-being, psychological adjustment, feeling more fulfilled in life goes hand in hand, and it complements really nicely. Feeling like you've got greater social adjustment and functioning, feeling like you're more motivated to get your schoolwork done. You have these skills needed to do high quality schoolwork. Feeling like you are a bit more capable in driving forward positive change when there's a need for it, so on and so forth. But we were also able to hone in on and look among our Minds Matter active students and see, okay, for students who have been to a few more club meetings, is that going hand in hand with some other areas of adjustment? Are they even better off in some spaces? And with a few measures, we see that coming out. The students who feel like they are better supported by their peers, is there even greater adjustment? And that's a really nice area where students who are feeling that support, they are sky high in a lot of other areas that we really care about. That's one of my favorite measures, so I like that. And leadership as well. So that greater involvement, the greater responsibility, but also that greater involvement and investment that folks like Chase have been involved with, also standing out in some positive ways for all these other measures of adjustment. So it's kind of across the board. We see some really exciting ways that fit with what we tend to expect, that you're having more success in this one space, should hopefully be fitting with more success in these other spaces. And then there's some questions on, okay, how can we promote that success? We're seeing our Minds Matter students as a whole looking really nicely on some of those different measures. They tended to be a little bit higher on some of those ways they're reporting adjustment. Our other peer students were also doing well overall. So the nice thing was, it wasn't like there were any, massive night or day differences between our students, depending on whether they were in clubs or not. But there seemed to be something that was holding together a little bit more nicely among current club members that was really encouraging here as well.
That's fantastic. Thank you for walking us through some of the nitty-gritty. I'm mindful that we've just got a few more minutes left with the audience, and so maybe I'm going to go over to Mo, who I think has been monitoring the chat and is going to frame up a few audience questions for us to dig into before we wrap up in a couple.
Yes, thank you. If folks have anything else that they want to, amplify or put in the chat, definitely feel free to. But I do want to jump to this question from Laurie. Is there baseline data on students in schools with OMM clubs, or was the club already established when the study began? And I think I'll probably popcorn that question to Wei, although Dr. Booker, I saw you just had a really strong reaction.
I can start, and Dr. Booker can just chime in and or add to what I share if I miss anything. So I think that's a fair concern. I think Dr. Booker mentioned earlier that there is limitation with our current research design. And not having the baseline data is one that we've thought deeply about, because this is not a pre-post research design. We unfortunately do not have baseline data to show where students started. It is possible that OMM teams were already a bit more well-adjusted than their peers to begin with. That's an honest limitation, right? We do not know that. We don't have data to tell us that. However, though, our preliminary findings from earlier years of research, when we did collect pre and post data among OMM club members, we were able to see increases in adjustment outcomes from fall to spring, indicating that involvement in the club did lead to positive adjustments. So even if they, as in the OMM teams, were well adjusted to begin with, there's still evidence suggesting that they benefited from club participation, and that from our own internal program evaluation, I do see the similar trend as well. So we do, for our internal program evaluation, we collect baseline and outcome data from our club members each year. And what we've seen there is also, very encouraging. So last year alone, we were able to track a match sample of about 106 students from the beginning to the end of the school year. And the results also show that these students were able to see growth in terms of their resiliency, their sense of connectedness, their openness to seeking support, and also their ability to support their peers. Alongside with these changes, their overall mental well-being improved as well. So while we can't really say with absolute certainty that every difference began with OMM, the evidence that we have gathered over the years paints a hopeful picture. Involvement in OMM doesn't just attract well-adjusted teens, it helps shape them into stronger, more connected, and more compassionate young people, is what I would say.
That's fantastic.
Yeah.
Oh,
I would only just add that we held off on some of those multiple time waves in the more recent years just because of logistics. So just thinking of kind of the time demands, the administrative demands for folks. If we can continue finding some ways to sort of streamline and ease those burdens, absolutely. The gold standard, 3, 4, or more waves to sort of really track folks nicely and be able to have a much stronger argument on what's going on for them. Great questions.
Mo, maybe we'll go to you for one more question from the chat, if there's one top of mind, before we start to wrap up.
Yes, y'all know I love the data and the numbers, but we've been talking a lot about the ripple effect, and I think it will be helpful for folks who might not know what an OMM club looks like. Chase, I wanted to popcorn it to you to see maybe if you'd want to share a bit about some of the campaigns that you were able to do back when you were a club leader and the ripple effect that you were able to see from those.
Yeah, of course. So I think school-wide campaigns were often relatively simple, like simple messages, but they definitely had a ripple effect. Like for example, Miss McCormack helped us organize like therapy dogs that would come kind of outside the entrance of our high school on like a maybe every 3 weeks or so, and we would make sure to advertise it like via our club and make sure our club's name was attached to it. And so I think students obviously seeing a dog is going to brighten your day, at least for me. And so I think students saw that as kind of like an invitation to come to a club meeting. We also had an event where we drew positive messages with chalk, like on like the brick outside of the school and the sidewalk, with positive affirmations and things like that. And yeah, we did several other um things where we would more like heavily advertise meetings to like the entire school. Like for example, we had a coffee with a counselor event where someone came in and talked about like dialectical behavioral therapy and its importance in um improving one's mental wellness. So I think that was really important. And then I think it's all coming back to me as I'm remembering this. We had like mindfulness Wednesdays, kind of as we were coming out of COVID, where a counselor would come to the courtyard at the end of the school day and we'd have like a 15-minute mindfulness session. That was really nice. Any student was welcome to join. And then finally, we had a mental health resources fair a few different times in kind of the main hallway of our school just to share for like the school psychologist, Miss McCormack, counseling resources. Um, we got like a newer thing, which I'm forgetting the title, but I think it was like the mental health specialist. And at least for me, um, this speaks to the importance of sharing those resources because it's hard to access that support. And I found students saying that they were more open to talking to the school psychologist. And I myself, when I was going through a difficult time, talked to the school mental health specialist, and it was really that like maybe 20-minute conversation was really impactful. So as you can see, there are a ton of different things that were yeah, it was a lot of great effort that really joined our community together.
Thank you for sharing that. Awesome. Well, I know we're right at time basically, so I'm gonna leave it here for today, but thank you to all the panelists. I'm gonna pass it back to Lauren to close us out.
Thank you so much, Aras, Dr. Jiwei, Dr. Booker, Douglas, and Chase for that wonderful discussion. I'm so excited to announce that our white paper is officially released. So everyone in this event will receive an email shortly with the link to download the full report. We may not have gotten to all the questions. So regardless of if you had some more right now or if you think of some in a little bit, please reach out to us. Our contact information is in the report and on our website. We care so deeply about shared learnings and collaboration, so please be in touch. I know for me, today gave me such a dose of hope, and I feel so inspired by the mental health champions in this room. Thank you all so much for joining us today.